Did you know? There's a disease that, if detected early, offers an almost certain chance of survival. But if detected late, that chance becomes as fragile as a single strand of hair. Even more alarming, it's now affecting people under 50. Many people think colorectal cancer only affects the elderly. The truth is, the rate among people under 55 has doubled in the past few decades. Are you overlooking the warning signs? 91% survive 5 years if detected early. Only 13% if detected late. This gap is not just numbers, it's life, family, and the precious years of living. 1. Introduction and the danger of colorectal cancer. Colorectal cancer is a disease that, when mentioned, causes worry for almost everyone, and that concern is completely justified. It is one of the few cancers where, if detected at an early stage, the chances of successful treatment are extremely high, and in many cases, it can even be completely prevented. But, tragically, if detected late, it becomes extremely dangerous, difficult to control, and directly life-threatening. In recent years, colorectal cancer is no longer considered an elderly person's disease. In the past, most cases were diagnosed in people over 50. Now, however, this trend is shifting in a troubling direction. Cases among younger people, especially under 55, have doubled in just a few decades. This increase has been so rapid that health experts now view it as a new epidemiological phenomenon, requiring in-depth research to identify the causes. According to the U.S. National Cancer Institute, NCI, colorectal cancer has now risen to become the #1 cause of cancer death among people aged 20 to 49. This is truly shocking, as this age group was previously not considered at risk for the disease. The key to understanding the danger of colorectal cancer lies in survival rates by stage. If detected while the tumor is still confined to the colon, without spreading beyond it, the 5-year survival rate is as high as 91%. This number offers tremendous hope to patients and families. But if the disease progresses and spreads to other organs such as the liver or lungs, the survival rate drops to about 13%. This gap highlights the life-saving power of early detection. It can be the difference between life and death. One major reason many people are diagnosed late is that early-stage colorectal cancer often causes no obvious symptoms. Many cases are found accidentally during routine checkups or tests done for unrelated reasons. By the time clear signs appear, such as gastrointestinal bleeding, rapid weight loss, or changes in bowel habits, the disease is often advanced. That is why the medical community continually emphasizes two critical factors in reducing mortality: regular screening and raising public awareness. If people understand that colorectal cancer is fully detectable at an early stage, and take the initiative to get checked even when they feel healthy, we can save countless lives, especially among younger individuals who rarely consider themselves at risk. Colorectal cancer does not discriminate by age, gender, or profession. It advances silently, but it can be stopped if we stay one step ahead. And that step is vigilance, proactive health checks, and never ignoring any unusual changes in the body. 2. What is colorectal cancer? To understand colorectal cancer, we need to start with the basics. Inside the colon, a section of the large intestine about 1.5 meters long, small growths called polyps can sometimes develop. At first, these polyps are usually benign, meaning they do not pose immediate danger. The problem is that over time, some polyps can undergo changes, with the cells inside them multiplying abnormally and uncontrollably. The starting point of cancer, this transformation does not happen overnight. It typically takes years for a benign polyp to turn malignant. This is both bad news and good news. The bad news: the process is silent and symptomless, leading many people to ignore it. The good news: with early screening we can detect and remove polyps before they ever become cancerous. The most effective screening method today is colonoscopy, a procedure in which a doctor uses a flexible tube with a camera to examine the entire lining of the colon. If a polyp is found, the doctor can remove it immediately, diagnosing and treating in the same session. This makes colorectal cancer one of the few cancers where prevention and early treatment can happen simultaneously. Good news is that polyp removal is a simple, minimally painful procedure that greatly reduces the risk of developing colorectal cancer. On the other hand, if we skip this stage and allow polyps to grow and turn malignant, treatment becomes much more complex, potentially involving partial colon removal, chemotherapy, radiation therapy, and significantly lower survival rates. Put simply, a polyp is like a seed, and cancer is like a poisonous tree. If we pull out the seed before it sprouts, our garden of health remains safe. Colonoscopy is the tool that allows us to do just that. 3. Early warning signs to watch. For colorectal cancer often develops quietly, sometimes showing only subtle bodily changes that are easy to overlook. However, spotting these early can greatly improve the chances of successful treatment. The following are important warning signs. 1. Changes in bowel habits. One of the earliest signs is an unexplained change in bowel movements. If you suddenly develop diarrhea or constipation lasting for weeks without a clear reason, get checked. Particularly concerning is alternating diarrhea and constipation. This may indicate a tumor partially blocking the bowel when open. Stool passes loosely. When blocked, constipation occurs. 2. Unexplained weight loss. Rapid weight loss without changes in diet or activity is a red flag. Colorectal cancer can interfere with nutrient absorption in the gut, steal nutrients to feed the tumor. Thanks to substances secreted by cancer cells that sap the body's energy. 3. Blood in the stool. Hematochezia, bright red blood in stool, is a classic symptom. While hemorrhoids or diverticulosis are common causes, it should never be dismissed. Only testing can confirm whether it's from cancer. 4. Black stools. Black, tarry, foul-smelling stools may signal bleeding from the upper digestive tract, stomach, duodenum, or from the right colon. As blood travels through the intestine, it darkens, a sign that needs urgent medical evaluation. 5. Iron deficiency. Anemia. Many patients with early colorectal cancer lose small amounts of blood chronically through stool. Over time, this leads to iron deficiency and anemia. In men especially, iron deficiency anemia must be investigated. Colorectal cancer should be ruled out. 6. Feeling of incomplete bowel movement. Tenesmus tumors in the lower colon or rectum can press on the bowel wall, making it feel as though stool remains even after defecating, often mistaken for irritable bowel syndrome, but if persistent, it requires examination. 7. Persistent bloating or abdominal distension. Tumors can partially block the bowel, trapping gas and waste, causing bloating. Cancer can also disrupt gut bacteria balance, producing excess gas. If this lasts for weeks without dietary changes, be cautious. 8. No symptoms at all. Alarmingly, many people with early colorectal cancer have no symptoms. This is why it's often diagnosed late, highlighting the critical importance of routine screening, especially for those over 45 or at high risk. In short, any unexplained change in your digestive health warrants attention. Early detection not only makes treatment more effective, it can save lives. Don't wait for obvious symptoms. By then, it may be too late. 4. Screening recommendations. Screening for colorectal Cancer is the golden key to detecting the disease in its early stages when treatment is much simpler and the survival rate is nearly absolute. Medical experts have issued specific guidelines for each risk group, based on the likelihood of developing the disease. 1. Average risk individuals. This group includes people with no family history of colorectal cancer, no chronic inflammatory bowel disease, and no previous detection of high-risk polyps. The latest recommendation from the American Cancer Society is to start screening at age 45, 5 years earlier than the previous guideline age 50 due to the concerning trend of the disease affecting younger people. Main screening methods. Colonoscopy, considered the gold standard. It allows doctors to directly examine the lining of the colon to detect polyps or tumors, and to remove polyps during the same procedure. If results are normal, the test can be repeated every 10 years. Stool-based tests. These include fecal occult blood test (FOBT), fecal immunochemical test (FIT), or stool DNA test. They are less invasive and can be done at home but are less accurate. A positive result still requires a colonoscopy for confirmation. Depending on the type, these tests are usually repeated annually or every few years. 2. High-risk individuals. This group includes people with a family history of colorectal cancer or high-risk polyps, especially in first-degree relatives, parents, siblings, or children. Chronic inflammatory bowel disease, ulcerative colitis, Crohn's disease, a history of higher-risk adenomatous polyps, or previous colorectal cancer. For this group, screening should start earlier, at age 40, or 10 years earlier than the age at which the affected relative was diagnosed. For example, if your father was diagnosed at age 45, you should begin screening at 35. Colonoscopy is the preferred method for higher-risk individuals, typically repeated every 3 to 5 years depending on previous results and medical advice. 5. Final message. Colorectal cancer is not a death sentence if detected early. Statistics show that when the disease is still localized, the 5-year survival rate can reach 91%. But if detected late, after the cancer has spread, that number drops to just 13%. This gap alone shows the critical importance of proactive health checks. Recognizing symptoms is only part of the picture and often the late part. Many cases present no warning signs until the disease is already advanced. That's why prevention and regular screening are far more important. Colonoscopy, stool tests, and other screening methods not only detect cancer but can remove the risk entirely by eliminating polyps before they have the chance to turn malignant. Health is priceless, and no one can protect it better than you. Don't wait for problems to appear before you see a doctor. Treat screening as the safest and most rewarding investment you can make, where the return is time and quality of life. In the next video, we'll explore the causes and ways to reduce colorectal cancer risk in younger people, a troubling trend that's on the rise globally. Taking action today is the best way to safeguard your future and the future of your loved ones. Conclusion. Colorectal cancer spares no one, but we can stay one step ahead. Prevent, screen, and take action while you're still healthy. Treat every screening as a shield protecting you and your loved ones. The health you protect today is the most precious gift you can give your future. If you found this information helpful, don't hesitate to hit like so I know you're here with me. Subscribe to the channel so you won't miss the next health videos, because the right knowledge at the right time can change a life. And if you know someone who should hear this, share the video as a gift of health. Together we can live well, live happily, and live fully each day.